This case is an excellent example of additional structures we can see beyond what the clinical case was for. We can visualize the structures within the heart, including the pulmonary trunk, ascending aorta, superior vena cava, the pulmonary arteries and veins, as well as the different chambers of the heart. By zooming in, we can see some of the additional structures within the thoracic cavity, including the superior vena cava, which would be formed by the junction of the right and left brachiocephalic veins, the ascending aorta, which would give off branches off of the arch of the aorta, including the brachiocephalic trunk, the left common carotid, and the left subclavian arteries. It would then continue as the descending or thoracic aorta, which would pierce the diaphragm approximately at the level of the 12th thoracic vertebra, which we can see here posteriorly as the 12th rib joins with this vertebra. If we add in the soft tissues as well as the hard tissues from our selection screen, we can add opaque, hard, and soft tissues, which would allow us to visualize the lungs within the pleural cavities. Here we can see the right lung occupying the right pleural cavity as well as the left lung occupying the left pleural cavity. Now, this also shows us that the cardiac impression and the cardiac notch are components of the left lung to create more space for the heart within the mediastinum centrally. If we change this by looking at the X-ray mode, we can also see the appearance of these same structures. The heart centrally within the mediastinum, the presence of the ribs posteriorly coming off of the vertebral bodies, as well as the presence of the diaphragm. The left dome of the diaphragm over the spleen, as well as the right dome of the diaphragm over the liver. Next, we can look at the opaque soft tissues to gain a better visualization of the branching of the bronchus within each lung, where we can see the branching from secondary to tertiary or segmental bronchi within each of the pleural cavities. By changing the opacity to transparent soft tissue, you'll be able to isolate out the lungs within the pleural cavities as well. So in this instance, continue to move that, we can see the trachea descending from the neck, where it will branch into the left and right main or primary bronchi. We can see that the right main bronchus is shorter than the left, and it is also more vertically oriented, which would explain how in many patients something that was swallowed or ingested, inadvertently ending up in the windpipe or the trachea, will predominantly end up in the right lung. By selecting the opaque hard tissue, you can now readily study the bony thorax consisting of the ribs as well as the vertebral column, as well as change the opacity for the internal organs, the musculature, as well as the skin superficially in this specimen.